So when it comes to processing sensitive data, and I think here already covered some of it, but we're definitely seeing stricter requirements in different states, but the exact obligations vary. In terms of children's information, like I said, Maryland has taken a more restrictive stance, and they have prohibited certain uses such as sale of children's data without parental consent. While states like Virginia and Colorado, they have introduced amendments that impose additional obligations in businesses that are processing minors' information, like carrying out DPAs. For sensitive information, Maryland also prohibits the sale of sensitive information and restricts its processing to situations where it's only strictly necessary. So these could be, for example, when it's a contractual necessity or with the explicit consent of the data subjects, or when it's for public safety. So those are the only cases when sensitive information can be processed in Maryland. And for California, on the other hand, they have introduced the right to consumers to limit how their sensitive information is being used, which adds another layer of consumer control. Another type of specific data processing that we're seeing some differences in is biometrics information handling. So Colorado has stricter regulations for biometric data under the Colorado Privacy Act, which requires businesses to implement additional safeguards and conduct DPAs like we discussed. But Illinois, on the other hand, allows consumers to sue for violations under Biometric Information Privacy Act, or BIPA, and Colorado empowers regulators for enforcement. So then there are also these other states like Texas and Washington that also regulate biometric data with varying consent and storage requirements. And California includes biometric data as sensitive personal information under CPRA and gives consumers control over its use. The last bit of specific type of data processing where we're seeing differences is consumer health information. So states like Connecticut, Maryland have introduced specific provisions on consumer health data, and Maryland imposes geofencing restrictions to prevent tracking individuals near sensitive locations such as reproductive health clinics. And both Maryland and Connecticut require explicit consent for sale of consumer health information. So while there are overarching trends, the details definitely vary by state, significantly vary by state.